Global HR Research presents our 2014 webinar series, delivering you the latest in HR news, legislative updates, and industry trends. As a provider of leading talent screening, management, and assessment solutions, we are here to ensure your company's continued success. Global HR Research. We redefine your HR expectations.
Hi, everyone. My name is Megan Schamfelter, and I'm the Manager of Communications and Events here at Global HR Research, a leading provider in talent screening, talent assessments, talent acquisition solutions. For the past 4 years, Global HR Research has been ranked as one of the top providers of background screening, drug testing, and pre-hire assessment solutions by HRO Today magazine. I'd like to welcome everyone and thank you for joining us today on our webinar entitled Pre-Employment Drug Screening 101. Today's webinar will be presented by Christine Peacock, Director of Strategic Relations with Global HR Research. This will be a silent webinar. If you have any questions, please feel free to type them into the questionnaire box and we will respond throughout the presentation. The entire content of this presentation will be available on our website, www.ghrr.com, 48 to 72 hours after the completion. Also, after today's webinar, you will receive a follow-up survey where you'll be able to ask additional questions, make comments, and/or inquire about Global HR Research Solutions. At this time, I'd like to thank Christine for being here today and turn it over to her.
Perfect. Thank you, Megan. All right. So, guys, again, this is going to be a silent webinar. I do want to make sure that everyone can hear me clearly. On your option next to your chat box is the ability to raise your hand. If you'll do so, it just lets me know that you're good to go. Perfect. All right. Well, thank you guys for letting me know. Okay, so let's get started here. We've got a lot to cover. We've got an hour here. Before I get started, I just want to give a heads up. In today's content, obviously, this is for educational and informational purposes only. It is not deemed to be legal advice or counsel. If you do have any questions, type them into the questionnaire box. I will try to answer them as best as I can. For anything more specific, I'll probably reach out to you individually. We can have that one-on-one discussion. Or if it's anything kind of more on a legal basis, I am going to ask you to refer back to your legal counsel as they're going to give you better and probably, well, no, just better advice than I will. Just short introduction just on myself. Again, I'm the Director of Strategic Relations here at Global. I've been with the company for about 6 years, so I've been in this industry. Literally started as a researcher, worked in occupational health, worked in customer service, and now I'm kind of on this side of things, so I've seen it all. My primary responsibility today is education and consultation with our current and prospective clients. For those of you that are on the line, you're probably going, hey, she looks and or sounds familiar. I used to be Christine Wynn. I am essentially the same person, just a different name. And as you guys can probably tell, I already talk very quickly. So we do have a lot of info. You're going to hear me speak quickly. I apologize. I will try to be as clear as possible. But kind of like my image there, we're going to cram a lot into one little box today. So we've got a lot of space to cover. I do want to leave a lot of time for question and answer as you guys have them. Megan will go through, she'll interrupt me through each of the sections so that way we can answer those as best as we can. So first we're going to go over kind of languages. I think when we talk about even background screening, but even worse in drug testing, there's a lot of acronyms, and I want to make sure that we're all talking about the same thing, that I can kind of help educate you why certain things are in place, what's the benefit of those items, whether you have a current process today, you're looking to provide this process, just so, again, we're talking the same language. Rules of engagement, what you should expect from your third-party administrator, so someone who is providing you your drug test program, what your expectations as the end user or client should be. And I'm going to tell you things that you should not stand for and things that you should expect. So whether you're using Global HR Research or not, come back to us and say, hey, are you guys doing these things for me? Obviously, we'll confirm with you if we are. And then kind of go over different types of drug test panels, types of drug tests that are out there, pros and cons, what the actual process is. I think this is one of the things that will help a lot of you that you're doing drug tests today. I hear this quite a bit from our clients. Well, you know, it's a negative. Why don't I get it back immediately? I just want to kind of show you that process. But in terms of collection, the testing, validity testing, confirmation testing, and even what the role of that MRO is, And then I'll talk about the two most popular programs, obviously DOT and Drug-Free Workplace, and then I'll leave some time for question and answer. All right. So again, silent webinar. If you have questions, type them into the questionnaire box and I will answer them to the best of my abilities. All right. Languages. So first and foremost, and I already kind of said this already, is a TPA. TPA stands for your third-party administrator. Okay. That technically is your drug testing vendor. So if you're getting an all-in-one solution, you're getting background screening, drug testing from your provider, they may be your background screening vendor, but they're also known as your TPA. Essentially, that person or that TPA owns the accounts for the labs. So the benefit is this, because they own your accounts and all of their other clients' accounts, they have a volume discount, right? So I've heard this quite a bit. Well, I can just go directly to the lab and purchase it. Absolutely. The great news is, if you're working with the right vendor, they're going to be able to negotiate that pricing because they have a bigger volume than you do, so they can give you a better price. They can also do specimen tracking, so if you have any questions, comments, concerns, whatever it is, they can track down every drug test that you have. Customer support, those of you that have worked with LabCorp, Quest, some of the other labs that are out there, I mean, let's just be upfront. I work very close with both labs, Quest and LabCorp. Customer service is okay if you're calling that 800 number. Sometimes you get the loop around. Probably some of you are nodding your head right now and know what I'm talking about. It just kind of depends. But what's great is if you like your background screening vendor, they're also providing the drug testing, they're providing you customer service. It's the same across the board. Your TPA can also provide different types of reporting to you that the labs will not provide to you. And then, of course, they can provide consultation. I think the most important thing that everyone has to realize, your vendor should be a part or an extension of your process. So whatever you guys would do internally for your drug testing program, your TPA should be doing the same thing. No ifs, ands, or buts. They have those capabilities. And I'll kind of get into depth when I talk about processes, when I talk about protocols, what that all means. You hear COC. Sometimes people call them chains. It's technically just a chain of custody. So it's an ordering form. It, in a way, shape, or form, it tells the lab or the patient service center, hey, we're taking a drug test collection and here's the purpose. Kind of the old school method is the paper-based chain of custodies. It is currently required for all DOT testing. I know some of you that are on the line are DOT regulated. Unfortunately, there's nothing we can do about it. You do have to stick with the paper-based. It's like that 5 carbon copy form. It does become cumbersome. But if you have any non-DOT or those of you that have no DOT employees and you're still using paper chains, I would highly encourage you to look at electronic chains. It's what I call the new school. You can use it for non-DOT. The benefits are tracking, meaning your TPA can track it, you can track it. You can literally see the drug test when it's collected. You can be notified when it's collected. You can be notified when it gets sent to the lab for testing. You can be notified when it goes into confirmation testing, and you can see when it's pushed back out of the lab. So you truly can see where everything is. Another benefit is expiration dates. So I'll talk about the old school method. You have these paper chains, you hand them to let's call him John Doe here is my candidate, or I'll call him donor. And now I may tell him he has to go in 24 to 40 hours, but who knows if he actually goes. So what's nice is with electronic chains, you can say, hey, John, I'm setting this registration up to expire in 48 hours. You must go. If John doesn't go in 48 hours, you'll receive an email notification letting you know, hey, he didn't go, right? So now you have kind of this updated status. Technology today is obviously pretty awesome. Registration, when I say instant, it literally takes 3 minutes to register someone, whether you're using LabCorp or Quest. It's a very easy process. If you're using the right TPA, so that keyword, that third-party administrator, they should also be able to manage this process for you. So for example, those of you that are on the line that are using Global HR product, you know that we can provide the service to you. It's pretty simple. You should be able to order the drug test. Your TPA can manage that process, again, as an extension of your drug testing program. They can instantly register that individual, and you can keep track of it. Or we can keep track of it, whichever you prefer. Okay? And scheduling is available. Some of you are probably using eChains today. Just so, again, same terms. Quest uses something called Fox Forms, same thing as eChains. LabCorp calls it LabCorp Solutions. Right. Another word, you're going to hear PSE, PSE. When I first came into this industry, I had no idea what in the world that meant. And everyone was like, well, it's a patient service center. I had no idea. I was like, what does that essentially mean? Essentially, it means it's a collection site when we're talking about drug testing. A lot of people ask, well, what's in network and what's out of network? In network, technically, as a collection site belongs to the testing lab. So if you're using LabCorp that's testing your drug results, the in network is LabCorp patient service centers. We see them all around. You can drive around and see LabCorp. If you're using Quest Diagnostics as your testing lab, then the Quest site locations are there, right? Out of network is technically a third party that only collects samples. They don't do any testing. So these would be things like Concentra. I know MedTox has their own lab, but oftentimes they're utilized as a third party collection. There's other ones called ArcPoint out there, so on and so forth. There's a lot of them. What you're normally going to find with a TPA, if you don't use their in-network patient service centers or PSCs, they will have a pass-through of collection fees, right? If you go to Dr. Joe's office down the road and Dr. Joe wants to charge $20 for the collection, we'll normally just understand that's going to be tacked on top of the normal drug testing. Some of you are probably saying, well, what about the rural areas? You're right. If we're dealing with a very rural part of town that doesn't have a LabCorp or Quest, and I'll talk about Quest third parties here shortly, then you're right. There is no option except for an out of network. That's just a negotiation you need to have with your TPA. Because again, volume, just like we have volume discounting with the labs, we can do a volume discount with the out of network locations as well, right? Please also remember, not all patient service centers can collect drugs or all different types of drug collections. So for example, we have a LabCorp right down the road from us. This LabCorp happens to be great. They collect urine samples, hair samples, saliva kits, they do everything. They even have a breath alcohol. Down the road a little bit, there's another LabCorp patient service center. They don't do any drug test collection whatsoever. They only do like titer testing, lab testing, blood draws, so on and so forth. Same thing with Quest. So just understand not every patient service center can collect your type of drug test. Okay. And then of course,
Sorry,
most...
we have one question for you. We have one person asking, they do a paper chain. How do they get set up for an electric chain?
Very easy. If you're using a TPA, reach out to your TPA and say, hey, I'm non-DOT. I don't want paper chains anymore. Put me on electronic. If you're going directly to the lab, so if you're going to Quest and or LabCorp, you can call them directly and say, hey, I want access to electronic chains, and they can set you up. A little longer of a process. So I do encourage you, if you don't have a TPA, to reach out to get one, but it's very easy. It should take them about 24 to 48 hours to get completed. And whoever asked that, if I didn't answer your question, please let Megan know, and I'll expand. Anything else, Megan?
Nope, that's it for now.
Perfect. Now, speaking of electronic chains, most all LabCorp, and when I say most all, I mean like 99.99% of LabCorp patient service centers accept electronic chains. I will say about 65 to 70% of Quest patient service centers accept electronic chain of custodies. The benefit for Quest, though, is they provide what they call a preferred third party. So Quest knew that they may not be able to cover all the locations nationwide. So they were very proactive in building relationships with some of those locations in more rural areas where they've negotiated collection costs. They have installed or put in machines to accept electronic chains. So a lot of them also take electronic chains. So you have benefits with both. That's why most of your TPAs will work with both labs. But again, Quest did a really good job, and it's a way for them to have control and consistent costs and collections. You'll hear this quite a bit, MRO. It just stands for Medical Review Officer. I'm a simplest person. An MRO technically is a certified physician. They've been certified by the MRO Medical Board, and they are in place for HIPAA compliance. I will say this. I've heard too many times before from current prospective clients, they're saying, well, we just ask our donor, and some of you are going to laugh at me and go, oh my gosh, I can't believe that. Some people have said to me, well, we just ask them to write it on a piece of paper if they're on any prescriptions, so that way if we get a drug test back, we'll know it's okay. Guys, We should not be doing that. I know it's not legal advice, but I'm going to tell you, please don't do that. You want the donor to be able to discuss what medications they're prescribed, what they're on with a physician, so we're not violating any HIPAA compliance. It is required, so an MRO is required for all DOT and specifically Florida drug-free workplace programs. Most states do suggest an MRO for drug-free workplace programs. Florida, for those of you that are here, it mirrors the DOT, so it is required. Okay? The benefits of having an MRO, obviously liability, risk mitigation. I know that's that word, right? Litigation representation. If you have the right MRO, no matter what, if a civil action lawsuit, anything comes against you about a drug test and your MRO reviewed it, let's say it's John Doe and he tested positive for marijuana. And he goes, I have never smoked pot in my life. You guys just don't like me because I'm young or old or male or I'm this religion or whatever it is. And he brings a lawsuit against you. Your MRO will stand trial and go over all the testing mechanisms, all of the GCMS tests, all the lab results, and confirm with them this is a true positive. You know, if let's take away marijuana. Marijuana is kind of weird. So let's say it's Vicodin. You know, I don't take Vicodin. I don't take any drugs. I don't even take Tylenol. I've heard that excuse before too, right? The MRO will say, look, we contacted you for the prescription. You gave us a physician. The physician couldn't confirm that they ever prescribed you that medication, so on and so forth. So they will be there for you. And again, that's with the right MRO. So I'd ask, you guys are looking to maybe place or start drug testing or even place your drug testing with a TPA, you also want to ask questions about that MRO as well, because that person, you really need to trust. They're reviewing all of your drug tests. They're going to be there for you, you know, if something were to happen. Again, I've already said this, but HIPAA compliance. They're also there for consultation. For example, our MRO, we love them. They're fantastic. Anytime we have a client that will ask us a question that we don't feel comfortable with, we're not really sure, our MO is available there to consult with that client to tell them what is best practice. Right? They can also provide clock letters and safety letters. A lot of you are probably going, what in the world is that? Some of you that are global HR research clients, you know exactly what that is. A clock letter is if the MRO reaches out to the donor to discuss with them a possible positive drug test. They're required to, by law, give them, in quotes, reasonable time to get back to them. While the MRO, after 24 to 48 hours, should provide a notice to you as the employer and the TPA that, hey, we've reached out to John Doe. He hasn't returned our calls. Here's the number he needs to reach, right? So everyone's kind of on the same page. And think of it as like a delay notification. Safety letters, these are required by DOT. If for any reason the physician is prescribing an individual a certain medication that may affect their ability to work, like on a machinery, drive, so on and so forth, the MRO will reach out to the physician and discuss with them, you know, did you know what type of job this person holds? Do you think it's going to affect their job type? Are you willing to change their medication? There's like a series of questions. Your donor and or employee's physician will sign off on all of these things, and you will receive a letter from the MRO providing you that information. Okay? All right,
One
again.
question about MROs, Christine.
Yep, go ahead.
Is the MRO employed at the TPA?
Sometimes and sometimes not. It depends. I would encourage you, well, hold on, let me take that back. It doesn't really matter. In my opinion, if you were to ask Christine Peacock, if I was coming in and consulting with you guys, I would say you would want to look for one that's external or third party. A lot of you, like, for example, are on the line. I know you personally. I've worked with you on multiple projects or accounts. If our MRO is in-house and you happen to be a part of this drug test, you don't want any conflict of interest. So it's very nice to have that MRO as a third party. So that the way there is no conflict of interest, there's no relationship. It's truly, if and when you need the MRO, you have the TPA kind of facilitate that relationship. And again, if I didn't answer your question, let Megan know and I'll try to clarify. Any additional questions, Megan?
Nope, we're good to go for now.
Cool. Now, we recommend, meaning Global HR Research, we recommend that an MRO be a part of every drug test, positive or negative. Because again, if anything were to happen, you want that MRO to be there for you as a part of litigation representation. Okay. You'll hear this. The The word SAMHSA, again, when I first started in this industry, I was like, it's not even spelled SAMHSA, but it stands for Substance Abuse Health Services Administration. Long story short, it is a federal program or agency that certifies laboratories on their, basically on their collection methods, testing methods. There's consistency on cutoff levels for drug tests. So what is truly a positive drug test for cocaine? What is truly a positive drug test for methamphetamines? All of those things. There are more than just two labs. A lot of times you'll hear, even I get used to it. I will say, well, we use the two certified labs, SAMHSA certified labs, LabCorp and Quest. There are more. It just, Quest and LabCorp happen to be the dominants. It's like saying, Target and Walmart. Those are the two large dominants in that industry. It's kind of the same way. And there's actually a handbook for the collection process. Some of you that are on the line, you may be doing your own collections. I would highly encourage you, if I have any employee health nurses on the line or individuals a part of the collection process, if you're taking the collections in-house, that you guys just review the handbook on the collection process. LabCorp and Quest is very good about providing things like train the trainer, where they'll train your staff to do the collections. But you always want to make sure that you guys are following what SAMHSA certified lab collection agencies are doing, right? Okay, so those are just the acronyms. What I want to go over next, I'm calling them rules of engagement, because these are, again, commitments and expectations you should expect from a TPA. During implementation, your TPA should conduct a site match, no matter how many locations you have, whether it be 3, 5, 5,000, 10,000 locations. They should do it based on your mileage expectations. So how, what's the nearest patient service center or PSC to my location within 10 miles, 15 miles. Obviously, the smaller the mileage, guys, just remember the limited that will be, and we may have to reach out to third parties. It doesn't become costly. I will say average-wise, it's between 10 to 20 miles. A good range is 15 miles. It will also be based on the lab. So if you're using a TPA, most oftentimes they can do both. They can do LabCorp and Quest, kind of like a mixture. Please don't expect to only use one lab. If you're using just one lab and you're still having third parties, reach back out to your TPA and say, hey, while I may pay an extra X amount, is there, a Quest in location, or is there a LabCorp, depending on what you're currently using? That way you guys can start saving some money. It makes no sense for you to be paying those extra collection costs if one of the other labs is available in your area. And then, of course, the site match can also be conducted based on your preferred network. Anytime that you transition vendors or TPAs, people always think of it as like a hostile takeover. Look, if you have a network you like, your TPA should keep your network, right? It's not just something where it's like, oh, well, we're going to change vendors. We're going to change the whole process again. If you like what's working for you and you're good with that process, your TPA should keep the same thing. They may offer solutions to improve that process or maybe save you some money, but essentially it's up to you. Again, an extension of your process, your program, right? They should also identify your programs. They need to be asking if you're DOT, non-DOT, if you're drug-free workplace, zero tolerance workplace, so on and so forth. Okay. And then also identifying your needs. Oftentimes when I'm talking to HR and I talk drug tests, everyone always thinks about pre-employment. We always seem to forget the other portion of it: workers' comp, post-accident, reasonable suspicion, randoms, all of these things. Essentially, your TPA can handle all of that for you. We just need to make sure we know who the decision makers are and how you want these reported out. Invoiced, reported, so on and so forth. Your protocols, your procedures. And then throughout the relationship, when we talk about protocols, which I told you guys I would kind of dive into, they should first identify and adhere to your protocols for consistency and compliance, right? So again, keep saying this, but an extension of your process. If you say, hey, I'm only allowing my donor 24 hours from the time that I get a hold of them to take the drug test, your TPA should hold the same values, right? If you said, okay, after I notify you, I'm going to give you 5 days to take the test. That's your process. That's what the TPA should do. I've heard too many times, why people are leaving their current vendor and they're looking for a new TPA is because, well, after 2 days, they close it out and I'm stuck. The guy was on vacation and, we normally extend those things an extra couple of days, or we ask for them to take a drug test while they're on vacation. Again, it's whatever your protocols are, but they should be identifying that with you. They should also identify what you want to happen if there's a dilute or adulterated result. Do we do a recollection or a new collection? Are we doing originally a split sample or split specimen collection? Are we retesting the split sample? What do we do on a shy bladder, meaning someone cannot provide, when it comes to a urinalysis test, they can't provide enough of the urine sample? I guess it's kind of weird because I always feel like I'm discussing things I shouldn't. If we're doing hair testing, if there's insufficient hair, so if you guys are doing hair testing and someone goes in and they're bald and they don't have any hair in their body, what do we do then? If your donor, employee, whoever it is, denies the test, what is your policy, right? Also, you should expect them to track your turnaround. If any of you have ever gone back to LabCorp or Quest and said, hey, I'm having issues with my turnaround, can you provide me a report? Again, some of you probably shaking your head here. It's like this giant Excel document that tells you nothing, right? So your TPA should be able to provide that documentation for you. And also, they should be taking into consideration and providing you notice and understanding if we're using third-party collection sites that can extend the turnaround time. Confirmation testing can also extend the turnaround time, and the MRO can also extend the turnaround time as well. So again, your TPA should be educating you on these things. I don't have time today to go through that full process. And if you guys want to have a conversation offline with me one-on-one, I'll be more than happy to discuss that. And then, of course, they should be able to change and update your patient service center. If you're having an issue, even if it's LabCorp, if it's Quest, if it's a third party, whoever it is, you're having an issue with that patient service center, you should be able to pick up your phone, call your TPA and say, hey, these people were rude, they're uncleanly, they're never open, whatever your process is, and they should make that change immediately for you. Okay? So I'm kind of giving you guys this ammunition. You're having an issue, your TPA should change it. Okay? Same things, again, that you guys would do internally. So, remember, benefits of a TPA. Remember, this is your drug testing program. Yours. Not the TPA's, not what they think you should have, yours. Okay? Your TPA is there to help keep your program consistent and in compliance. So make sure they know your policies, everything, understanding. Obviously, they should be asking those from you up front. If they're not, you can always be proactive. Obviously, from my end, I love it when clients are proactive, like, hey, by the way, here's our policies. But just make sure they have a copy of it. And yeah, I get it. Yes, you can go directly to the lab and manage your services directly through them. But again, benefits of a TPA, volume discount, specimen tracking, customer service reporting, and consultation. Okay. All right, I'm moving on to the next slide. Megan, do we have any questions before I keep going here?
Nope, no questions as of now.
Perfect. Panels. This is probably the most confusing thing in the world to people. I don't know why. It's very easy. But I think what happens is a lot of you on the line have adopted a process already, or you've come into an environment where they've already made up the process and you're going, wait, this doesn't make sense to me. Why are we doing this? Or maybe you're legal saying, no, we only do this. I want to explain the different types of panels that are available, what drugs are commonly being tested for, and I'll make my suggestions as well to you guys just in general. So first and foremost, what is a panel? Essentially, a panel equals the number of drugs that are tested. So a 5-panel tests for 5 drugs, 6-panel, 6 drugs, 10-panel, so on and so forth, right? We can do the math here. There are expanded panels for specific industries like healthcare. So those of you that are on the line that deal with individuals that may have opportunities to prescription drugs, painkillers, things like that, there are more specific type drug tests that are for that realm or field. If no one has suggested that to you, I'll be more than happy to. But again, we'll talk one-on-one on that. This is huge for me. There is no such thing as a standard. I've been on sales calls. I've been on, consultation and consulting calls here. And people will say, well, I'm just doing the standard, or I'm doing a standard 5-panel, or, I'm just doing the normal drug test. There's no such thing because like we said, number of panels equals the number of drugs tested. You essentially can select what drugs and cutoffs that you're testing for, right? You could say, yeah, I'm going to do a 5-panel, but in my 5-panel, I want A, B, C, D, and E. And the next person next to you could say, yeah, I want to do a 5-panel too, but I want A, G, Z, Y, and X. Okay? Here's my recommendation. Ask your TPA what's most often used, right? Which I'll kind of go over today anyways for you. And remember, federal requirements should always kind of be the baseline for what's considered the gold standard. So you take what federal guidelines are and you say, okay, at a minimum, I should probably do this, because if you, again, were ever to go to court, you want to show some type of due diligence. You can say, hey, here's what the federal government thinks is okay, so I follow the same process. Essentially, that's why Florida drug-free follows the same process as DOT, right? Here's the problem. Remember, if you're DOT regulated or have DOT employees, you essentially have no choice. You can only do a DOT drug test. October 1st of 2010, just FYI, I'm sure you guys are like, duh, of course, Christine, we know this. DOT did change from what they called a 5-panel to what now they call a 5 expanded opiate panel. I'll go over that with you today. But yeah, you didn't know that, just know, don't worry, the lab's already changed it. It's not like you have to go back to the lab and go, oh my gosh, I didn't know, what do I do? The lab's already made the change, and your TPA should have already made the change for you as well. All right, so let's go over some panels. Notice I'm calling them typical, because again, there's no standard, but these are the most common or typical drugs tested for each of these panels. I'm going to start with a 4-panel because, as we all know, Washington, Colorado legalized the use of marijuana on a recreational basis. So a lot of you that have offices there, work out of there, have said, okay, we're not going to test for THC. So essentially, this is THC removed, and it's most often used in Washington and Colorado. I will probably have another webinar later down the road discussing this type of screening in general for THC, specifically for Washington and Colorado. I will give you the long story short. If you are in Washington and Colorado, can you test for THC? The answer is yes. The MRO will follow federal guidelines, right? So the way the federal guidelines are is federal government does not recognize THC as a legalized substance that can be prescribed, right? There's like Marinol drugs that can be used for cancer, but not, what's it called? Just marijuana in general, not the chemical format. So they don't recognize it, so the MRO will still provide that as a positive. So you can test for them, but I'm not going to get into too much detail today. If you want to talk about it offline, I'll be more than happy to. Okay, so 4-panel includes methamphetamines, common use word, meth. Obviously, there's more. I just wanted to give normal names. Cocaine. I didn't think there needed a translation. It's cocaine. Opiates are things like morphine, heroin. Benzyclidine, it's basically PCP. A 5-panel just adds in marijuana. Your DOT panel, if you notice, I'll go back here. This is a 5-panel. This is your DOT. It's identically the same. The only difference is they added to an opiate. That's why they call it an expanded opiate. It's called a 6-AM. I don't know what it stands for, don't ask me. But it includes more things like heroin, morphine. It just basically expands it, allowing them to test for more of these type of opiates that are being more and more abused in society today. Okay. I'm going to skip now to a 7-panel. It's identically the same as a 5-panel, or what we call a typical 5-panel. It includes things like barbiturates, benzodiazepines, like Valium and Xanax. So I'm going to stop real quick. Those of you that are doing a 5-panel drug test, and I know some of you are on the line that are doing that today, and you've probably heard me say this before, this means you're missing things like Valium and Xanax. Let that sink in for a second. Okay? This is why I recommend that you go back to your TPA and understand what drugs you're testing for, and really understanding with your legal team and making a business decision on possibly expanding new panels. For the cost, it shouldn't be that much. It's not like, and these are really off numbers, but let's pretend my 5-panel drug test today cost me $30. It's not like a 10-panel cost $60. You're talking literally probably range between $5 to $10 difference. Okay? A 9-panel is identically the same, but it also includes methadone and propoxyphene. That's synthetic heroin, which has been really, unfortunately, popular. It's weird. You give an addict synthetic heroin to get off of heroin, but now we're finding societies abusing the methadone. Now, I think it's a street name. I can't remember what it is, but you're seeing the more frequent use of that medication. And then those individuals that are allergic to like Vicodin, people are like, oh, Vicodin makes me sick, it makes me itchy, whatever it is. The opposite of that is propoxyphene, also known as Darvocet. So individuals who can't take Vicodin, physicians prescribe Darvocet. So you're also missing that. And then a 10-panel on top of that includes methaqualone. You'll hear it called Quaaludes or Quads, or it's just basically like a sedative, or at one point somebody told me, I think it's a horse tranquilizer. It's not a horse tranquilizer, but it is pretty darn close. It's a highly addictive, and it is a painkiller. Okay. So went through all the panels, just common, typical panels, kind of tell you what drugs you're looking for or what you're missing maybe out of your current program. Things that you may consider adding to your drug test program. You can take anything. You can say, well, I have a 5-panel today, but I want to add in X. I have a 7-panel today, but I want to add in blank, right? You can do that. Things that I didn't talk about in the slides there is alcohol. Alcohol testing, you can do it via saliva, breath, and blood. I'll talk about the different types of testing you can do. My recommendation is, well, I'm sorry, I missed one. You can also do it urine, but it's not my recommendation. That's why I probably didn't put it. Recommendation for alcohol, do it via saliva. It's very easy. I'll talk about that process. Notice ecstasy is not discussed. Oxycodone is not discussed. Tramadol is not discussed. This is a very, I guess, more frequently now used for a painkiller. You see it a lot in after surgeries. They'll provide it to you after any type of back surgery, joint surgery, anything like that. Tramadol's there. Pain patches. Our corporate offices are located in Florida, so I'm actually very familiar with that. Everyone talks about how Florida has all these pain clinics. We do. And unfortunately, this is one of the most prescribed medications because it's like a nicotine patch, but provides pain medication all day long. So fentanyl testing, and then Demerol testing as well. Okay. Megan, do you have any questions about the panels before I move forward here? I'm going to assume no. Okay. So let's move forward and let's talk about the different types of testing and pros and cons. We're going to talk about urine, saliva, breath alcohol, hair, and blood testing. Urinalysis. So pros and cons. Pros, it's the most common. Literally the most common. It's DOT required. Cool part, for those of you that are DOT regulated, the Department of Transportation currently is reviewing the ability to do saliva drug testing. Today, they've already approved saliva alcohol testing. So it's great because it's instant, it's available to you, it's very quick, it's self-collected. We'll talk about saliva testing here shortly. But they are also looking at providing saliva testing for DOT, which will make your lives much easier. It's way easier for post-accident, reasonable suspicion, and randoms. Okay, it can be really inexpensive in comparison to the other types of drugs. There is a large selection of drugs that you can test for, and it can be collected actually by a trained member of your staff. And I kind of talked about that earlier. But we can do a train the trainer. So your TPA or the labs can train someone on your staff to take a urinalysis collection. Some of you are probably going, ew, don't want to do that. That's cool too. But it is available. For those of you that are DOT, we can also do it for your DOT collections as well. The downsides of urinalysis. Now, this isn't really a downside. It's the second bullet point that is. Technically, the detection period for a urinalysis is what people normally consider the norm. Notice all these things are in quotes. The problem with urinalysis is the detection period changes based on metabolism and frequency of use. So if I am a habitual pot smoker, well, THC is going to stay in my system for a longer period of time than someone who smokes it once a year, right? Which is how your body responds to toxins in its system. I will say urine alcohol testing has been questioned in litigation. Urine or alcohol metabolizes very different depending on gender, weight, health, so on and so forth. And also diabetics tend to produce ethanol in their urine more frequently than others. So it's kind of one of those things where I don't normally suggest alcohol testing being done via urinalysis. There are other and better ways to do that. Okay. So I'm going to move forward now to saliva/oral testing. The pros of this, self-collected. You have a box of test tubes. You say, hey, John Doe, pick a test tube. John Doe, I have like a little image here. They pop off the top. They have this thing that looks like a Q-tip. They swab the inside of their mouth. You see the little blue line. Most saliva kits have this. Indicates that, hey, we've got enough cells. You're good. Stick it in a little vial, and you ship it off to the lab, right? So you don't have to send them anywhere. It's self-collected. It's non-invasive. So they just swab the inside of their mouths, like brushing their teeth almost. DOT does allow it for alcohol and, again, drug testing in the future. It can be inexpensive. Relatively, sometimes for the same cost as your urinalysis you can get for saliva kits, your alcohol testing is really, really inexpensive. So those of you who are doing breath alcohol, you're probably paying anywhere between, let's say, $15 to $55 for your breath alcohol. I'm talking for your saliva, you could be paying anywhere between, $8 to $15 for the saliva kit for alcohol only, right? So it's relatively inexpensive. Few options for masking, right? If I know that if your employee knows that you have a drug test that's available to your managers or in human resources at any time, and I want to walk in high as a kite or drunk or whatever it is, I'm probably not going to do that, knowing that at any time you could walk up to me and say, hey, I need you to take a drug test. Right? And it's a great resource, again, for post-accident reasonable suspicion workers' comp. For those of you that have programs that include urinalysis, I would encourage you to do like a mixture or a blend of the different types of testing. Urinalysis for pre-employment if you'd like, and then maybe have a bunch of these kits for just post-accident. If something really were to happen, I don't want to wait until they go to the hospital. I don't want to wait until they get to the lab, or I don't want to wait until, whatever. I want to do the drug test right now so I know. Okay. The downsides, the detection period is more recent. So this has to do with more recent use. There is a small selection of drugs available for testing. It is getting better because this is becoming more and more popular just because of the ease of use. So you'll see over the next, I'm hoping the next couple of months, but at least the next couple of years, that you're going to have a wider selection like you do in urine testing. And the other problem with this is it does have a shelf life. The average is about 6 months. So whomever you're getting your saliva kits from, because they're kits, right? You have to pay for them up front. They normally make you buy them in like batches. I think it's like, I want to say the labs require you to do them like 20 or 25 a piece. So if you don't have a lot of employees, it can be somewhat of a waste of money because it's only lasting for 6 months. Okay. All right. I'm moving on to breath real quick because you can only do breath, which is alcohol. Pros, it's relatively accurate. Cons, it can be really expensive, and it's cumbersome on finding a location that can be conducted. If you can't tell, I'm not a huge fan of breath alcohol, just because, again, it's expensive. You have to find a place, and DOT approved the saliva kits, and it's way easier. Right? Hair testing is another. Now, pros, long detection period, upwards to 3 months of use, which is great because, people can't also mask it. It's your hair. Downsides, it's costly. It is 100% costly. If it's not 1.5 times of a urinalysis, it can be 3 times as much as well, depending on the types of drugs that you're testing for. So just know if you're going after hair testing, it is quite expensive. They're, again, kind of like saliva testing, it's not the most common. So there is a small selection of drugs available for testing. The other issue, you must have a certified collector. Now, I didn't write this one down, but they also have to take a large batch of hair. I think everyone thinks, like in this picture, oh, it's just a small amount of hair. They do have to take a large amount. So your prospective employees, current employees, whatever it is, sometimes they don't like it when you create a bald spot somewhere. So just know that. And then, of course, sample inefficiencies. If they're not able to take enough of that hair, what are your protocols at that point? What happens if someone has short hair? What do we do? What if they don't have any hair? What if, you say, okay, well, if they don't have any hair, let's do a urinalysis collection. Well, is it fair across the board? Because again, this is a longer detection period. So if someone is testing positive for marijuana, they smoked 3 months ago, and someone who walks in that has no hair, and you're doing urinalysis, and maybe they smoked it 3 weeks ago, but it was not as frequent, just think about those things as you're writing your policies. All right. Next is blood. Pros and cons. Pros, it's the most accurate. It's very limited availability of mass or adults to your sample. I don't really know how you can mask your blood. Downside, it can be costly. It is invasive, right? Because you have to have a phlebotomist complete the collection. And also it's, donors don't like you to take their blood. I'd like a job. Perfect. I'd like to provide you the job, but give me some blood. It doesn't really work out very well. So it's not as common, but it is available. Okay. So I am running a little behind on time. Megan, I want to check in with you to make sure I don't have any additional questions before I move forward with the process.
Yep, I have one question quick for you. Will you talk about screening numbers in the panels, how to interpret the results on a test? For example, we have one person who had a report that read marijuana, screen is 50, confirm is 15.
Gotcha. So that's called a GCMS test. Those are cutoff levels. Really, for you, what you should be reading is it positive or is it negative? My question for you is, did that come from the MRO or did it come directly from the lab? Because the MRO should be providing you in the certified copy only that it's positive. If it's negative, they're not required to provide you that cutoff. But essentially what those numbers are, and again, I'm not a lab person or a scientific person, but the first number is where they have, imagine kind of a graph, if you will, and that's the line. If it's above that line, you're positive. And then the next one is kind of a more in-depth screening. It's normally a lower number. This is okay. If you're still above this line, then yeah, it's still a positive. So it's just a confirmation that it truly is a positive and not a false positive. If I didn't answer your question, again, let Megan know and I'll clarify, or we can have a one-on-one conversation. Okay. So the process, guys, I got 10 minutes and I'm going to talk really fast, but I'm hoping I get through this pretty quickly for you. I want to give you the narrative format because I have a nice little chart that we can go through, but it's pretty simple. There's 4 steps: the collection, the actual testing, the MRO review, and then the results. The collection, the donor goes to the PSC and provides a sample. Pretty easy, right? The sample then goes to testing. There's what's called an initial test. Guys, go back to your TPA and ask if validity testing is being conducted. If you're using the lab, go back to the lab and ask them if your drug tests include validity testing. There should not be a price difference for you, okay? What it does is it tests for the creatinine. Basically, it's a substance that's only in human urine. So it's going to test to say, hey, is this human urine? I know some of you are laughing, but we know sometimes people try to, use fake urine. It's just, I don't know, it's strange. They also look at specific gravity to see if it's diluted, and they look at the pH level. This tells us if we have a valid sample of a human urine sample, okay? It should not cost you anything more to do validity testing on your drug test. So go back to your TPA and understand. Those of you that are using Global, my occupational team will hate me if I don't say this. It is included if you're doing drug testing through Global HR. So please don't call us. I'm telling you now, it's all included. Okay. For those of you not using Global, please do that. If it does test positive, or like that the individual who asked that question, if it does initially test positive, it goes through confirmation. So you have the GC side, then you have the MS side, and that just tells you, hey, this truly is a positive based on several testings and statistics. It will go to MRO regardless if it's positive or negative. The MRO, if it is positive, will do a donor interview. They'll provide you the safety letter, clock letter. We talked about those, and then the results. Okay, let's look at the process map. Let me grab my pen. Okay, so here's my little donor. Here's the chain of custody. They go to the PSC site. Here's the initial test. We have 2 outcomes. I'm going to follow the positive path. It tests positive. It goes through confirmation testing. There's that GCMS test. Okay. Pardon me. It then goes to the MRO. Notice, even if it tests negative, it should go to the MRO regardless. MRO reviews it, make sure that the collection was done correctly, the testing was done correctly, and we really got real results, okay? They determine, is it positive? Is it negative? If it is positive, and I'm going to follow that route, they do a donor interview. After that, you will either get a positive drug test or a negative drug test, right? You could get a negative drug test if someone is actually being prescribed Vicodin. They tested positive here, up here, right? But they're being prescribed, they're taking it the way they're supposed to. The physician is aware. It's no big deal. Okay, great. You'll get a negative result. There's your final report. Last couple of slides. Common drug test programs. I'm going to talk about drug-free workplace and DOT. I'll start with DOT. Essentially, I know I've kind of already talked about this. It's a 6-panel expanded opiates as of 2010. Some people call it as a 5-panel plus panel. Like I called it a 5 expanded opiates panel. Some people call it a 7-panel. Guys, it's a DOT panel. It doesn't matter what it is. And like I said, when it did make the change, the labs automatically said, if this is a DOT account, automatically change to the new one. So you should not have an issue. But I would, if you weren't aware of this, confirm with the lab, confirm with your TPA just to make sure. Dependent on the segment of DOT, randoms must be conducted annually. The standard or typical is 50% of the drug or 50% of your population must be tested for randomly tested for drugs. 10% of your population should be tested for alcohol. Again, annually. However, typically these are conducted quarterly, monthly, and or yearly, depending on your turnover. If you guys are only doing this annually, depending on the size of your business, depending on the number of DOT employees you have, I would highly encourage you reevaluating and going to quarterly. Just because you have to show documentation at the end of the year that you did everything you can to do at least 50% randomly. Okay? And then, of course, your reporting is required at the end of the year. The other thing that's required is an EAP program. EAP stands for Employee Assistance Program. Essentially, it's a 3 strikes you're out. I can't fire you. I can't lay you off. I can't replace you. You're allowed to test positive for 3 times until I can physically terminate you. Okay. And again, only urine testing for drug, breath or saliva for alcohol. And again, saliva drug testing is being considered for approval by the DOT today. And then last slide here, drug-free workplace program, also known as DFWP. Technically, the requirements, guys, if you plan on doing this, please understand, yes, it's a great program. There's a lot of work a little bit on the front end. Mainly it's your policies, but your TPA should be able to walk you through this, provide you samples, and tell you exactly what you need to do. I haven't bullet pointed here, not in full detail, but just know you have to have a policy. You have to make a decision with your current employees if this is a new policy that you're implementing. Meaning you can't test your current employees until after 60 days, or you can grandfather them in. You can say, you know what, you guys are here, I'm good. Essentially, the way the government looks at it is if you didn't have a drug-free workplace program before and now you're implementing one, you need to allow your employees to clean up, I guess, and you have to give them 60 days to do so. You have to provide notice to your employees that you're implementing a drug-free workplace program. You have to, moving forward, every single time do a pre-employment drug test, and they have to be negative in order before you can employ them. They can't test positive. You can say, well, I still want to hire you. We'll just work on that later. Doesn't work. If they test positive for pre-employment, you're done. But if they're a current employee and you send them for a drug test for reasonable suspicion, workers' comp, whatever it is, for Florida only is required. Again, it's recommended by almost all other states. Florida, it is required. It's the same thing as the DOT. You have to have 3 strikes, you're out type of rule. Can't refire them, can't replace them, can't lay them off, so on and so forth. A minimum of 5-panel drug test for Florida only. You can essentially do whatever panels that you want, but at a minimum for Florida, 5. Because again, remember, it mirrors DOT. Benefits of implementing a drug-free workplace program: workers' comp discounts. Guys, you can get anywhere between 5 to 8% per person on average. And it just changes. And of course, risk mitigation, right? Okay. This might be the first time I've ever finished a webinar right on time. So I've got 4 minutes left, guys. I'm going to be on the line for question and answer. Megan, do we have any questions right now?
We have one. What if you get a negative dilute result?
Perfect question. Normally, what your TPA is going to say to you is, what's your policy? So this is one of those protocols that you guys should already have kind of a business decision on what you want to do. A negative dilute technically means, okay, we did a test, the sample was diluted. Oftentimes what can happen is, let's go the positive route. They show up, can't pee, I can't pee. The patient service center will continue to provide, the requirement is 6 ounces every half hour to your individual, or maybe it's 8 ounces to your donor, so they can produce a urine sample. Sometimes people go, okay, I have to go take a drug test. I need to drink a lot of water because right when I get in, I want to provide my sample and get out of there. I got other things I got to do, or I got to go to work or whatever. So sometimes people overdrink and dilute their urine. That's essentially what it means. If you have a policy and you provide, or that protocol, you provide it to your TPA, there's 2 things. We can, on the forefront, always take a split sample. And if it's negative dilute, the TPA can go back to the lab and say, hey, or the MRO can, again, depending on how involved your MRO is, can go back to the lab and say, hey, grab another split sample and test that one for me because this one was negative dilute. Other programs can be, okay, if it's a negative dilute, we need to reach out to our candidate or donor or whomever it is again and ask them for an immediate retest. It's up to you. I don't have a preference one way or the other. I don't really suggest one or the other. It's just a business decision that you guys have to make on what happens internally.
Okay, we have 2 more. One kind of ties into the one you just answered, so I'm going to pull that one up first. Is there a such thing as a positive dilute?
Yes, there can be a positive dilute. Again, if you're having an MRO, the MRO has already reviewed that information, should have already had the donor interview. So that means if the donor did not provide a prescription or provided a false one or could not provide one, and it was still diluted, because anytime you see that diluted, that means validity testing is being conducted, and that's being done at the initial test. So that dilute tag will follow the drug test sample as it goes through, even when it gets to the MRO.
Okay, 2 questions still. We'll start with this one. It came in first. For DOT testing, is it up to the employer to drug test contract employees, or is it a DOT requirement?
Oh, that's a good question. It depends on your contracts. So whoever asked that question, and actually, let me go to the next slide. Here's my contact information. Let's talk about that offline. It really does depend on your contracts on how you've explained that. I will say this. Most of the subcontractors I have worked with, the contracts will say, if you are subcontracting to us, it is your responsibility as the subcontractor to drug test your DOT employees. If you have vendors providing services to you, in some contracts I've seen, you can push it back and say, nope, your employee, your responsibility. I've also seen in types where you'll say, yeah, I'll do them so I can have my reporting, but you're going to pay for them. So it just depends. So I'd be more than happy, whoever asked that question, to have a one-on-one with you if you'd like, or go back to your legal and ask them.
Okay, and then we have drug-free workplace policy does not allow 3 strikes, but states employees must request EAP or other treatment before exposed by reasonable suspicion testing. That has been this person's policy for a while. What does the 3 strikes refer to?
Typically, that's for Florida only. So if you are in Florida, the 3 strikes you're out is the EAP program. So they're required to do, or you have to allow them to go through an EAP program 3 times before you can terminate. If you're not in Florida, your policy is fine. It's just Florida only requires the 3 strikes you're out. Okay. So Megan, I'll stay in the line for the next several minutes or so if questions keep coming through, and I'll answer them. But before I turn it back over to you, I do want to thank everyone for joining me today. Again, my contact information is on the screen. If you ever need anything, feel free to reach out.